Hi, my name is Dr. Divya Patel. I'm a child psychiatrist as well as an adult psychiatrist practicing at the Center for Developmental Psychiatry. Today, I wanted to talk to everyone about ADHD. I think ADHD has been a hot topic on social media, in the media, and a lot of people have been thinking about what that means for themselves or for their children. And so today, specifically, I'd like to talk to families who may be dealing with a child that may have ADHD or wondering if their child has ADHD and what that might look like. Many families or many people colloquially feel that ADHD looks like hyperactivity, swinging off the walls, really having a hard time sitting still. And although for a lot of kids it can look like that, there are other manifestations of ADHD that are pretty common and sometimes missed, especially in children that are not hyperactive or not, behaving in ways that are as disruptive to the classroom or to families. And so I think those are things that are important to think about. Some of those things might look like daydreaming, zoning out, having difficulty completing a task, right? Having difficulty completing multiple tasks at once, multitasking, often forgetting about things in the school setting. It could be forgetting assignments or, forgetting directions to where they're going in a classroom or where they were supposed to be. And in the home setting, it can be forgetfulness around what your mom and dad told you to do or tasks that they are responsible for and constantly having to be reminded or constantly having to require a lot of redirection to complete a task. It can look like a lot of emotional dysregulation for children. And so oftentimes I see kids coming in with a lot of big feelings and around situations that maybe normally we wouldn't expect a lot of big feelings or a lot of moments. And oftentimes there is a co-occurring ADHD diagnosis where these children have a little bit of a harder time regulating their emotions and a harder time really kind of managing big feelings. And so I think that in families, it shows up as tantrums, shows up as difficulty really communicating and dealing with rules and structure in the house. And then at school, it comes off again as maybe talking out of line, maybe not listening to the teacher, maybe having a lot of anxiety around schoolwork. And so oftentimes when we think about ADHD, sometimes we also still think about how that relates to ADHD. And when we think about the school, if things are more difficult, if it's harder for you to concentrate, if you're more forgetful, you are going to develop some form of anxiety around completing those tasks. And so when I talk to children and families, it's my job to sort of provide that discernment of whether or not the anxiety is coming from ADHD or if it's coming from other things. And oftentimes, I think it's very unique to the person and the family, and there isn't one size fits all sort of diagnosis or picture. I think it's really just helping understand what may be going on for your kiddo and what could be helpful. A lot of the times children with ADHD, because they're getting so much negative feedback from school or from parents due to some of their vulnerabilities or struggles around organization and completing tasks, they develop a lot of self-esteem issues and maybe a lot of negative self-talk again, which can increase rates of anxiety and depression in these children. And so I think understanding it as a full picture is mostly helpful for a lot of people, as opposed to one thing or the other. Typically, there's a combination of a lot of these things going on, especially as the children get older. Um, all of this to say, I think we always think about what we can do to help as parents and then also as teachers, clinicians, doctors, what we can do to help provide structure and consistency for a lot of these children. People with ADHD really, really thrive on structure and a schedule. And so thinking about environments that are predictable, that have a good structure, that the child can really focus and enable themselves to succeed is going to be important. in the home setting, thinking about breaks and summer vacations where things tend to be a little less structured, how you can add on some structure, some predictability, working with someone to create schedules, visual charts, visual representations of what the child is to expect for that day, what their responsibilities might be for that day, oftentimes helps. I think it can be really, really stressful, especially when it's younger children who may be having a lot of behavioral problems or a lot of difficulty with ADHD in the household. And so sometimes we recommend parent coaching. And really, that's just obviously to have support of learning some of these ways to provide structure and consistency for your kiddo, but also learning different ways of communication and different ways of tackling some of these problems that they might be having behaviorally. Obviously, at the end of the day, I think really trying your best to understand your kiddo long term is the best solution, and forming their helping them form their lives in a way that helps them thrive is all of our goals. We always recommend, if you're concerned about your kiddo, if the school is concerned about your kiddo, just try to seek a professional opinion. Oftentimes, we recommend early intervention, even with medications and with therapy, to be able to address this developmental trajectory that may not be as positive for them without these interventions. And so when I think about kids with ADHD, I oftentimes think about the psychological repercussions of not having treatment or not having the tools to be able to be successful and thrive, and how that can impact a person and how that can impact their ability to have relationships, to have a career, to have a successful life. And so I think when you're thinking about treatment and what you can do to help, always thinking about the full picture and thinking about what the benefits of treatment would be, as well as what the risks of leaving things as they are would be. We're here at the Center for Developmental Psychiatry to help any parent or any child that might be going through something that is difficult or disruptive to their life. We oftentimes provide a lot of guidance and a lot of support in making these decisions. It's never an easy decision to have your child on medication or to have some of these treatment options included in their life. And so we always are ready to meet you wherever you might be, and just really understanding what your options are so that you can make an informed decision for your child. I hope that's helpful in understanding ADHD and understanding whether or not that's something that might be going on in your own household and what you can do to help your kid. Thank you.